In this video, we'll start to have a look at the effects of the sympathetic nervous system on specific target cells. So let's start by having a look at cardiac muscle cells. So norepinephrine, when we have norepinephrine being released, it binds onto the beta-1 receptors. Now, this is going to have a big impact on the heart, because what it does is you open ion channels in the cardiac muscle cells, and we'll talk more about this when we get to the heart chapter. And the overall effect is that it's going to increase both the rate and the force of contraction. And when we get into the heart chapter, this is going to become quite apparent that if you increase the number of beats per minute and you increase the force of contraction within, say, a ventricle, more blood per contraction leaves, that greatly increases what we call the cardiac output. So what does that mean? Is that the blood delivered to the tissues and the blood pressure will increase, and this helps you to maintain homeostasis during physical activity. Now let's have a look at the effects on smooth muscle cells. So norepinephrine binds to receptors and has the following changes. Now, it depends where you are as to what's going to happen. So we get constriction of blood vessels associated with the digestive, urinary, and integumentary system. And in this case, norepinephrine will bind to alpha-1 receptors. And the effect here is to actually decrease blood flow to these organs. Because of course, if I'm going to constrict blood vessels to these tissues, then of course blood flow is going to go down. Now if you think about what am I trying to do? I'm trying to take blood that's going to the GI tract, the urinary, and some of the skin, to redirect it to things like the heart, to muscles that I can use under sympathetic activity. And the urinary system certainly takes up a lot of blood at rest in terms of making urine. So the reshuffling or reordering where the blood goes becomes very important. Now, it has an effect, as I said, we're talking about the effects on smooth muscles. So here in the blood vessels, it did one type of thing. Now here, dilation of the bronchioles. The bronchioles do have smooth muscle within their wall, and the norepinephrine binds to the beta-2 receptors. And what this does is it causes the dilation. Now, if you're going to dilate the bronchioles, it means there's less resistance for air to move in and out. And if you decrease the resistance, then you increase the airflow. So the dilation of the bronchioles allows for air to move in and out of the lungs easier. So that also would assist with sympathetic activity. Now, how about dilation of blood vessels that are going to skeletal and cardiac muscles? In this case, the norepinephrine binds to the beta-2 receptors. And in this case, what it does is it causes a dilation of blood vessels to the skeletal and cardiac muscles. So more blood can flow to your heart muscle, to your skeletal muscles, and of course this would support sympathetic activity. Now how about looking at urinary and digestive sphincters? Because sphincters, most sphincters in the body are actually smooth muscle. There are some voluntary ones, but having a look at the involuntary ones, what's going to happen? So I get contraction of the urinary and digestive sphincters, and norepinephrine binds to the beta-2 and beta-3 receptors respectively, and it makes basically emptying the bladder and bowel more difficult during increased physical activity. So this is a pretty good indication or a reminder that it's not necessarily the neurotransmitter that's released, but it's the receptor in that specific tissue that can determine what the outcome will be. So as you can see, under sympathetic activity, there are some places where blood vessels constrict, and there are some places where blood vessels dilate based on receptor differences. So we also get relaxation of smooth muscle of the GI tract, and norepinephrine binds to beta-2 receptors, and that slows digestion during physical activity. Because your GI tract can use quite a bit of the amount of the blood in your body, a lot of cardiac output can go to the GI tract to do the peristalsis and all that other stuff. And when you're doing physical activity, you don't necessarily need to be doing that. We can wait to finish digesting. How about pupils? Because pupils do have smooth muscle within them. So the norepinephrine binds to the alpha-1 receptors, and it causes dilator pupae muscles to contract. Now, when they contract, look at the name, dilator. So they end up dilating. They open the pupil. So when you open the pupil, more light enters the eye. So this may give you a better sort of visual acuity during those times of activity. And then also we get constriction of blood vessels serving most exocrine glands. So the norepinephrine binds to the beta receptors in blood vessels serving the glands. Things like salivary glands. They decrease their secretion. Now, of course, the exception to this would be the sweat glands, because the sweat glands, of course, I need to get rid of excess body heat if I'm running or whatever the sympathetic activity is. Okay, so we'll end there, and then we're going to come back and start talking about what are the cellular effects that are happening in terms of cellular metabolism.